Hello, my name is Ginger Curry, and I'm going to talk to you about reducing racial and ethical disparity in healthcare. Nurses are central to the quality of care delivered to patients. They are active leaders and participants in improving healthcare, but nurses need your support to deliver better healthcare to all of our patients. As our governing board, you not only are a critical force in this organization, you can help nurses make lasting change at the bedside through your unprecedented commitment of resources and community expertise. You do help lead the way to better care, so thank you. As a nursing group, we would like to see improvement in our language services, and that is what I'm requesting of you today. We would like your support in our aligning forces with the Robert Wood Johnson Foundation to improve language services. Our hospital can do a better job to provide our patients with culturally and linguistically appropriate services. In our current state, racial and ethnic minorities are not always given the same opportunity for quality of health care, mostly due to language barriers rather than income or health care coverage status. We can make this better. Language services sometimes are done so ad hoc, where bilingual staff or patients' friends or family members or even other patients are used. These individuals, though well-intended, have not received interpretation skills or ethnics training and likely compromise the quality of the health care. What is needed instead is a consistent, comprehensive approach. Several studies have documented the detrimental impacts of language barriers to quality of care, providing evidence that communication between patients and the provider is truly critical to ensure high-quality care and patient safety. Poor communication puts the patient at high risk for misdiagnosis and misunderstanding of treatment, which can lead to adverse events, such as patients receiving deferred health care or drug complications, and these can be avoided simply by better communication. Understanding of medical treatment is challenging enough without the added difficulty of language or cultural barriers. As we focus on better patient care, now is an appropriate time to address language issues. The U.S. Census forecasts a dramatic increase in non-English speaking populations during the next 20 to 40 years. Currently, as many as 1 in 5 people in the United States speak a language other than English in the home. Moreover, approximately 50 million U.S. residents do not speak the same language as their health care provider, so our efforts to reduce language barriers for the patient will equally assist our health care providers. The Johnson Wood Foundation has published a National Health Plan collaborative toolkit, which has excellent resources to guide and instruct us in every step along the way. To give you a better idea of what I am asking of you for your support and to help also you to understand what this project would look like, I will broadly outline the suggested plan for implementing language services in our organization. First, we must conduct an assessment of the particular language needs and resources. Then we can develop a written policy outlining an approach for addressing the needs of the population we serve. The following 5 steps is a suggested plan for implementing language services. Step 1, we will conduct an assessment of language needs and resources. Step 2, we will examine the number of limited English proficient patients. Step 3, we will examine the frequency and type of contact with patients to identify priorities for interpretation and translation services. Step 4, we will determine priorities by examining the nature and importance of services that patients need at various points of contact with the plan. Step 5, we will develop a written policy with an approach for addressing the patient's language needs. Overall, what this involves is collecting information such as the patient's preferred language, both oral and written, as well as the needs for an interpreter With this information, we can examine the number of limited English proficient patients we serve, as well as the frequency and type of patient contact. This evaluation will identify priorities for interpretation and translation services. The written policies and procedures will be done after the evaluations and will outline how and when to use available language services. The written policies will address the following 6 elements: how to identify patients needing language services, points of contact within the plan for which language services are available, how to notify such patients about their rights to language assistance services, the types of services available, examples in-person interpreter or telephonic interpretation, the process for maintaining, monitoring, and improving language access services, the need to assess grade level of education and publication material. Having a written policy on the stipulations for language services will keep us accountable to our commitment to serve a diverse community, as well as be our guide to ensure consistent, appropriate approaches in communication with limited English proficient patients. Also, it will help in training and administration purposes. It is important to have a clear guideline for both staff and provider regarding what they should do when providing care to a patient with specific cultural and language needs. To conclude, our efforts to eradicate racial and ethnic disparities in healthcare must start with valid and reliable data on race, ethnicity, and language preference. Although collecting such data alone cannot reduce or eliminate disparities, gathering these data is a necessary first step in identifying disparities and the healthcare needs of specific populations and planning interventions to address inequalities in care. Without such data, healthcare plans cannot effectively define the problem or provide meaningful solutions. So I thank you in advance for supporting our efforts to achieve a consistent, comprehensive approach to patient-provider communication. A handout of the National Health Plan Collaborative Toolkit will be available to each of you at your request. Thank you.